appreciate that. We're going to try to stick to 2 minutes, folks. So we got lots of people asking questions. Yes, ma'am.
Policy in the abstract is one thing, but there are a lot of Dave, who, if you really want to get the story of what's going on, get them in a room and let them talk. I was in nursing school in 1973 when Richard Nixon stated he wanted to revamp our healthcare system. Yes, I'm that old. Stating that the American people deserved better than a chaotic delivery system with spiraling costs to leave a lot of hardworking Americans locked out. He stated that affordable, cohesive access was the right in the greatest country on earth and we shouldn't accept anything less. Nixon's plan included the ability to join Medicare as a subscriber. That is and still is the public option. So what happened? Well, Dan Storr, the Brian Williams of his day, in an expose you can find on YouTube, described the Republicans wanting the public plan, the Medicare option in before 65, or actually it was 63 then, and the Dems, led by Ted Kennedy, was pushing for a single-payer coverage. Neither had the votes. It died. I remember being shocked back then it didn't happen, because even then, the chaos, the confusing paperwork, the patchwork of coverage, and the time wasted away from the providers that my prior sister nurse described was cumbersome and impacted the interrupted care. It really impacted care, and it does more even today. Well, fast forward 36 years, and despite another 20-year attempt in 93, we are in an even more chaotic mess. Incremental programs have come along the way that have tried to quell crises. Programs such as the end-stage renal disease program, which addressed the fact that people were not being covered for dialysis and that they were meeting lifetime caps. ESRD cost $7.9 billion in 2005. Then came SCHIP, coverage for children, because as the premiums rose over the years, families fell out of coverage, and uninsured children came to numbers we could no longer ignore. We took this risk while the insurance companies enjoyed the lower risk and higher profit. You had Medicare, Famous, and all of that, and you get, well, you see where I'm going. You get to the point where all of these patchwork programs are coming to what real reform would cost.
Can you bring it to a close?
I will certainly try. I've cut this down 5 times. Okay. All right. It's the 36 years of this, but anyway. All right. Okay. All right. Again, the public option is opting into Medicare as a subscriber before. I mean, the infrastructure is already in place. Adding the co-ops, Mr. Cantor, and I respect your work, I really do, will add more layers to sort out. It will add to the confusion the prior lady described. Gentlemen, I'm asking you, will you commit to real reform with a centrist approach? It cannot be another incremental effort that will quell this debate. I ask you to punting this problem to another generation will be a dereliction of our duty. Remember, those who do not remember the past are doomed to repeat it. Thank you.
Yes, sir. Thank you very much. Yes, sir. Welcome.
Thank you, Tom. My name is Ben Ragsdale, and I want to thank the Giants Dispatch for this forum and for the excellent news coverage of this issue. It's yet another example of why newspapers are going to be relevant for a long, long time.
Okay, here you go. Here's my mom.
We'll get together later. Bobby, I'm glad that Congressman Cantor showed the bill. It shows that a number of you have been working very seriously for a long time. You've been listening to people. You've been finding solutions to our problems, and I appreciate it. On the other hand, I heard from the Congressman very little in the way of substance. I heard a lot of negativity, a lot of things that he's against. I heard 1 or 2 specifics about liability reform, so forth. We've heard that. He has a little 4-page position paper on his website. He mentioned, just buried in his remarks, that Republicans have the goal of expanding access. Now that's the core of this. Are people going to get the care they need? Are people going to be cut off from care? Are uninsured going to have the opportunity to buy affordable coverage? I want to know, Congressman, what is your substantive proposal to meet these real everyday problems that people have? Where's the beef?
Let me try and address that, Mr. Ragsdale, and also the prior questioners. I think if I can sort of summarize your question back there, not you, Mr. Ragsdale, the woman in the back, about your sense that we need to just have the Medicare option for everyone. And the problem with that, and as Bobby showed, the slides indicate that most beneficiaries on Medicare like what they have. Okay? But it is unsustainable. Both of us agree it's economically unsustainable. Part of the reason it's unsustainable is the cost, but it's also the cost shifting that goes on. Medicare in and of itself is like a price-fixing mechanism. The best nurses, the best hospitals get paid the same as the worst. Same thing with the physicians. It doesn't allow for merit-based compensation or incentives to be a better provider. I know you are, I'm sure, the best provider. But, as a system as a whole, this Medicare does not allow for that. It's not designed that way. Not to mention the fact that most providers that I speak to, and I'm sure Bobby gets the same, is they say they couldn't support their practice if they only saw Medicare patients, because the reimbursement rates are artificially low and not reflecting true practice expense. So what happens is, in a macro sense, these costs are shifted onto the private sector, which the employers are feeling the heat, as are the employees. When you see your co-pays go up, when you see your premium go up, and the share your employer requires you to pay go up. So that's why everybody's saying, time out, we can't afford it. We're just not. That's why you can't say you're going to have the Medicare you think you're going to have in a sustainable way. The money's got to come from somewhere, and then we get into the paperwork. Let me try and address Mr. Ragsdale's question about where Republicans are and what is our program. Well, first of all, because of what we've seen presented, we got to have those guarantees, okay? We got to have the context of guarantees. Let people have the quality. Make sure government doesn't deny the care. Let's make sure we don't break the bank. But we have plenty of areas we can agree on. I hope, speak to the specifics of, number one, pre-existing conditions. There's a reason why people get stuck. If you have Crohn's disease or MS or what have you, and if you lose your employer, you lose your job, or let's say you're a child of an individual who loses his or her job, you are thrust into the individual market. And anybody that's got those kind of situations in their family know very, very difficult to afford the insurance. In Virginia, we have something akin to what's called guaranteed issue. So people have to say they can get a proposal from the insurance company. But you know, as I do, that the price of that premium is so high, it's de facto unaffordable, so you don't have it. We've got proposals on the table, Republicans, Democrats alike, that say we can create universal access programs at the state level. Let's get some federal subsidy for these high-risk individuals, and let's just make an individual market work for these high-risk people. That's how you take care of the pre-existing conditions. Okay? And if over time that individuals will see they'll be able to go. Right now they can't. So we'll have to work with the insurance companies and make them allow for you to stay on your plan if you lose your job until we get that individual market done. We also have other instances on the table. We have the ability for small businesses, individuals to have the same tax advantages that you give to corporations now. Okay, that will also expand the market, help bring down prices, increase demand. That when the lady asks, how do you bring on competition if it's not the public option, this is how you do it. You promote more ability to save tax-free as consumers, as patients. It's not for everybody, but if you do that, you'll have more patients out there looking for insurance. If you couple that with the requirement that states have competition, so they look to other states, I see my time is up,